Welcome back. This is part 2 of previously seen on Nclex. This isn't just practice, this is survival. 30 high-yield Nclex questions that mirror what's shown up on the real exam. Answer them right, and you move closer to becoming an RN. Ready? Question 1. AV Fistula Care. A nurse is teaching a client with an arteriovenous AV fistula in the left arm about self-care. Which statement by the client indicates a need for further teaching? 1. I will check the site daily for a thrill and bruit. 2. I should sleep on my right side to protect my fistula. 3. I need to avoid carrying heavy bags on my left arm. 4. I will allow blood draws from my left arm only in emergencies. The correct answer is 4. I will allow blood draws from my left arm only in emergencies. Rationale. This statement is incorrect. The client must be taught to never allow venipuncture, IV insertion, or blood pressure measurement on the arm with the AV fistula/graft. Puncturing the fistula or compressing the graft can cause clotting, infection, or damage, compromising the site needed for hemodialysis access. Incorrect options. 1. Checking the site for a thrill, vibration, and bruit, swooshing sound, is essential. The presence of both indicates a patent, open fistula. 2. Avoiding pressure on the site during sleep or any time is correct self-care to prevent occlusion. 3. Avoiding heavy lifting prevents excessive pressure and damage to the site. Clinique RN Test Day Tip. For AV fistula questions, remember the primary rule: NO blood pressure, NO blood draws, NO IVs, NO tight clothing/jewelry on the access arm. Protect the lifeline. Question 2. Priority vitals post-dialysis. A client returns to the unit immediately following hemodialysis. Which assessment finding requires the nurse's immediate intervention? 1. Temperature of 100.2 degrees Fahrenheit, 37.9 degrees Celsius. 2. Blood pressure of 88/50 millimeters of mercury. 3. Heart rate of 98 beats per minute. 4. Complaints of localized headache. The correct answer is 2. Blood pressure of 88/50 millimeters of mercury. Rationale. Hypotension, 88/50 millimeters of mercury, is the most critical and common complication immediately post-dialysis. It indicates excessive fluid removal, hypovolemia, or rapid fluid shifts, which can lead to shock and myocardial or cerebral ischemia. This requires immediate intervention, e.g., Trendelenburg position, fluid challenge. Incorrect options. 1. A mild temperature elevation is common due to the warming of the blood during the circuit or a minor inflammatory response. A temp over 101.5 degrees Fahrenheit, 38.6 degrees Celsius, would be more concerning for sepsis. 3. A heart rate of 98 beats per minute is mildly elevated, but is a common compensatory response to fluid shifts, not an immediate crisis. 4. Headaches are common post-dialysis due to fluid shifts or disequilibrium syndrome, but are not as life-threatening as hypotension. Clinique RN Test Day Tip. The primary immediate complication of hemodialysis is hemodynamic instability, hypotension. The primary immediate complication of peritoneal dialysis is peritonitis, cloudy effluent. Question 3. ICP management. A client is admitted with a severe closed head injury. The nurse's highest priority intervention to prevent a rise in intracranial pressure, ICP, is to 1. Maintain the head of the bed, HOB, flat to promote cerebral perfusion. 2. Allow the client to cluster their own care activities. 3. Administer a prescribed stool softener daily. 4. Ensure the client's neck is maintained in a neutral position. The correct answer is 4. Ensure the client's neck is maintained in a neutral position. Rationale. Flexion or rotation of the neck impedes venous drainage from the head, directly leading to a rapid increase in ICP. Maintaining the neck in a neutral position is a simple yet crucial intervention for promoting optimal cerebral venous outflow and lowering ICP. Incorrect options. 1. The HOB should be elevated to 30 degrees Celsius to 45 degrees Celsius to promote venous drainage and lower ICP. Lying flat increases ICP. 2. Clustering care, doing all tasks at once, is contraindicated in high ICP as it provides excessive stimulation. Care should be spaced out, declustered. 3. A stool softener prevents the Valsalva maneuver, straining, which increases ICP. It is important, but maintaining neck alignment is the most direct and continuous physical intervention to prevent a sustained rise in ICP. Clinique RN Test Day Tip. For high ICP, remember the body positioning rules. HOB 30 degrees Celsius to 45 degrees Celsius and neck neutral. Question 4. Hyperglycemic crisis confusion. The nurse is caring for a client with a blood glucose level of 750 milligrams per deciliter, a pH of 7.38, and a negative urine ketone test. The nurse suspects hyperosmolar hyperglycemic state, HHS, rather than diabetic ketoacidosis, DKA. This distinction is primarily based on 1. The absence of profound dehydration in HHS. 2. The lack of severe acidosis in HHS. 3. The absence of hyperkalemia in HHS. 4. The presence of high-grade fever in HHS. The correct answer is 2. The lack of severe acidosis in HHS. Rationale. The key differentiator between DKA and HHS is the presence of severe metabolic acidosis. In DKA, insulin deficiency leads to fat breakdown, producing ketones, and severe acidosis, pH less than 7.30. In HHS, the client has just enough insulin to prevent fat breakdown, ketogenesis, so there is no significant acidosis. pH is near normal, 7.38. Incorrect options. 1. HHS causes more profound dehydration than DKA due to the extremely high glucose levels causing osmotic diuresis over a longer period. 3. Hyperkalemia is seen in both crises due to the shift of potassium out of the cells. 4. Fever is not a defining characteristic of either crisis. Clinique RN Test Day Tip. The differentiator. DKA has ketones, acids. HHS is usually higher sugar, more severe hydration loss, and no ketones. Question 5. IV extravasation management. A nurse notices that a continuous peripheral 4 infusion of 25% dextrose has infiltrated the tissue around the insertion site. The nurse's first action is to 1. Apply a warm compress to the area. 2. Administer the antidote phentolamine into the site. 3. Stop the infusion immediately. 4. Elevate the extremity and notify the provider. The correct answer is 3. Stop the infusion immediately. Rationale. The immediate, non-negotiable first action for any suspected extravasation or infiltration is to stop the infusion. This prevents further damage from the infiltrating fluid or medication. Incorrect options. 1. 25% dextrose is a hyperosmolar solution that causes chemical phlebitis and local tissue injury. It requires a cold compress to cause vasoconstriction and localize the spread, not a warm compress. 2. Phentolamine is the antidote for vasopressors, like norepinephrine, but not for hypertonic glucose solutions. 4. The infusion must be stopped before any other action, like elevation or notification, is taken. Clinique RN Test Day Tip. The universal first step for any IV infiltration, extravasation, or reaction is stop the infusion. Question 6. Arterial versus venous ulcer assessment. The nurse is assessing a chronic wound on a client's lower extremity. Which finding is most indicative of a venous stasis ulcer? 1. Ulcer margins are punched out and well-defined. 2. The wound is located on the lateral malleolus or toes. 3. The area surrounding the ulcer is hyperpigmented, brown. 4. The skin on the lower leg is cool and hairless. The correct answer is 3. The area surrounding the ulcer is hyperpigmented, brown. Rationale. Venous stasis ulcers are caused by impaired venous return, leading to chronic pooling of blood. This pooling causes the breakdown of hemoglobin, depositing hemosiderin in the tissue, which manifests as characteristic brown, hyperpigmented, leathery skin. Incorrect options. 1. Punched out, and well-defined borders are characteristic of an arterial ulcer. 2. Ulcers on the lateral malleolus, side ankle, or toes are characteristic of arterial ulcers due to poor perfusion. Venous ulcers are typically located over the medial malleolus, inner ankle. 4. Cool, pale, and hairless skin is indicative of poor arterial circulation. Clinique RN test day tip. Remember the VA difference. Venous to voluminous, wet, weeping, visible, medial ankle, velvet, brown, thick skin. Arterial to absent, no pulse, appetite, punched out, away, lateral/toes. Question 7. Peritoneal dialysis complication. A client receiving continuous ambulatory peritoneal dialysis, CAPD, reports severe, diffuse abdominal pain and the dialysate outflow, effluent, is cloudy. The nurse's priority action is to 1. Reposition the client to the side to facilitate drainage. 2. Send a specimen of the effluent to the lab for culture. 3. Increase the frequency of the dialysate exchanges. 4. Hold the next dialysis exchange and notify the provider. The correct answer is 4. Hold the next dialysis exchange and notify the provider. Rationale. Cloudy effluent and abdominal pain are the hallmark signs of peritonitis, infection of the peritoneum, which is the most serious complication of PD. The nurse must immediately hold the next exchange to prevent introducing more fluid into the infected abdomen and notify the provider to initiate antibiotic therapy. Incorrect options. 1. Repositioning is for poor drainage, but the quality, cloudiness, is the primary concern. 2. While sending a specimen is necessary, the first action of escalation and preventing further contamination must occur. 3. Increasing frequency may worsen the peritonitis and is not an independent priority. Clinique RN test day tip. For peritoneal dialysis, remember, cloudy effluent equals peritonitis. This is a medical emergency that requires immediate notification and treatment. Question 8. Ventilator alarm, low pressure. The low-pressure alarm sounds on a client's mechanical ventilator. The nurse finds the client is calm, and their oxygen saturation is 96%. The nurse's first action is to 1. Manually ventilate the client until the provider arrives. 2. Check the client's pulse and blood pressure. 3. Quickly check the ventilator circuit for disconnections. 4. Administer the prescribed PRN sedative. The correct answer is 3. Quickly check the ventilator circuit for disconnections. Rationale. A low-pressure alarm signals a loss of volume or pressure in the circuit, most commonly due to a disconnection or leak. Since the client is stable, the nurse's first, fastest, and most appropriate action is to inspect the entire circuit from the ventilator to the client's tube to quickly find and resolve the leak. Incorrect options. 1. Manually bagging is only necessary if the leak cannot be quickly found or if the client becomes distressed. 2. Since the client is calm and the peripheral capillary oxygen saturation, it is stable, a full vital sign check is secondary to finding the leak. 4. Sedation is unnecessary for a calm, stable client. Clinique RN test day tip. For ventilator alarms. High pressure to obstruction, kink, water, secretions. Low pressure to disconnection, leak, dislodgement. Always check the patient and the circuit first. Question 9. Chemotherapy complication. A client receiving chemotherapy has a white blood cell count, WBC, of 1,000 per cubic millimeter. The nurse should implement which precaution? 1. Contact precautions. 2. Droplet precautions. 3. Airborne precautions. 4. Neutropenic precautions. The correct answer is 4. Neutropenic precautions. Rationale. A WBC count of 1,000 per cubic millimeter is extremely low, indicating severe neutropenia, and ANC less than 1,000 cells per cubic millimeter. The client is severely immunocompromised and cannot fight off common organisms. The nurse must implement neutropenic, reverse, precautions to protect the client from external sources of infection, e.g., no fresh fruits/flowers, mask on the client when leaving the room. Incorrect options. 1, 2, and 3. These isolation types protect others from the client's germs. Neutropenic precautions protect the client from others' germs. Clinique RN Test Day Tip. Low WBC on the Nclex means a need for neutropenic precautions. High WBC means a risk of infection/sepsis. Question 10. Blood transfusion reaction. A client is receiving a unit of packed red blood cells, PRBCs. 10 minutes into the infusion, the client reports flank pain and the nurse observes hematuria, blood in the urine. The nurse's first action is to 1. Slow the rate of the infusion. 2. Stop the infusion immediately. 3. Notify the healthcare provider. 4. Obtain a stat urine specimen. The correct answer is 2. Stop the infusion immediately. Rationale. Flank pain and hematuria are classic signs of a severe acute hemolytic reaction, which is caused by the client's antibodies destroying the donor's blood cells. This is a life-threatening emergency. The nurse's first action is to stop the infusion immediately to prevent further blood product from entering the client. Incorrect options. 1. Slowing the rate will still allow the incompatible blood to enter the system. 3 and 4. Notifying the provider and obtaining specimens are critical steps, but are secondary to stopping the infusion, the source of the reaction. Clinique RN Test Day Tip. For any immediate adverse reaction, blood, medication, IV fluid, the nurse's first step is almost always to stop the infusion.
All right, quick break, because I need to show you something that can actually change the way you study for the Nclex. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you miss questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying, you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging Nclex-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the Nclex on the first try, check the link in the description and start using the QBank today.
Question 11. Sickle cell priority. A client with sickle cell anemia is admitted in a vaso-occlusive crisis. Which nursing diagnosis is the highest priority? 1. Risk for infection related to splenic dysfunction. 2. Ineffective peripheral tissue perfusion related to clumping of sickled cells. 3. Acute pain related to tissue ischemia. 4. Deficient fluid volume related to fever. The correct answer is 3. Acute pain related to tissue ischemia. Rationale. While all are relevant, the pain caused by tissue ischemia, lack of oxygen, is the hallmark symptom and is treated as the priority. Unmanaged pain is an indicator of ongoing, untreated ischemia, which can lead to permanent organ damage. The standard of care mandates immediate and aggressive pain management as it is the subjective manifestation of the crisis. Incorrect options. 2. Ineffective perfusion is the pathophysiology causing the pain. Pain. 3. Is the most immediate subjective threat to the client's well-being and is an objective measure of the severity of the crisis. 4. Fluid volume deficit is treated aggressively, hydration, but the combination of pain and perfusion issues places pain as the immediate symptom to target. Clinique RN Test Day Tip. For sickle cell crisis, the HOPS mnemonic is essential. Hydration, fluids, oxygen, pain management, narcotics, seek medical attention. Pain is the subjective priority symptom. Question 12. DIC management. A client with a severe systemic infection suddenly develops widespread bruising and oozing blood from the venipuncture sites. The nurse should anticipate which collaborative intervention? 1. Administering a dose of alteplase, TPA. 2. Initiating a large volume IV infusion of normal saline. 3. Preparing to administer fresh frozen plasma, FFP. 4. Administering vitamin K intramuscularly. The correct answer is 3. Preparing to administer fresh frozen plasma, FFP. Rationale. The client is showing signs of disseminated intravascular coagulation, DC, a condition where massive clotting consumes all clotting factors, leading to widespread hemorrhage. The definitive treatment for the acute bleeding phase is to replace the consumed clotting factors with fresh frozen plasma, FFP. Incorrect options. 1. TPA is a fibrinolytic, clot buster, and is severely contraindicated as the client is actively bleeding. 2. IV fluids alone will not replace the necessary clotting factors. 4. Vitamin K takes hours to synthesize clotting factors and is too slow for an acute DC crisis. Clinique RN test day tip. In DC, the body is doing two things, clotting and bleeding. The priority is replacing what's lost due to bleeding. FFP replaces clotting factors. Question 13. Hyperthyroidism diet. The nurse is teaching a client newly diagnosed with hyperthyroidism, Graves' disease, about dietary management. Which instruction should the nurse include? 1. Restrict intake of protein and carbohydrates. 2. Eat small, frequent meals with high caloric content. 3. Avoid foods high in vitamin D and calcium. 4. Limit fluid intake to 1,000 milliliters per day. The correct answer is 2. Eat small, frequent meals with high caloric content. Rationale. Hyperthyroidism causes a dramatically increased metabolic rate, leading to rapid weight loss, heat intolerance, and high energy expenditure. To meet the high metabolic demand and prevent further weight loss, the client needs a diet that is high in calories, high in protein, and served in small, frequent meals that are easier to tolerate. Incorrect options. 1. Protein and carbohydrates should be encouraged, not restricted. 3. Calcium and vitamin D should be encouraged to prevent osteoporosis, which can be accelerated by hyperthyroidism. 4. Fluid intake should be liberalized to prevent dehydration from increased perspiration. Clinique RN test day tip. Hyperthyroidism is a fast, hot, skinny disease. The care is aimed at slowing the metabolism and increasing caloric intake. Question 14. Bowel obstruction assessment. The nurse is caring for a client with a nasogastric tube to low intermittent suction for a small bowel obstruction. The nurse observes that the client's abdomen is distended and the client reports feeling nauseous. The nurse's first action is to 1. Increase the level of suction on the nasogastric tube. 2. Administer a prescribed antiemetic. 3. Aspirate and irrigate the nasogastric tube with normal saline. 4. Reposition the client to the right side and obtain vital signs. The correct answer is 3. Aspirate and irrigate the nasogastric tube with normal saline. Rationale. The distended abdomen and nausea indicate that the NG tube is likely obstructed, clogged, preventing decompression. The most direct, non-invasive, and effective action is to attempt to clear the tube by aspirating the contents and irrigating with a small amount of normal saline, following institutional policy. Incorrect options. 1. Increasing the suction will not work on a clogged tube and may cause gastric mucosal damage. 2. Administering an antiemetic treats the symptom, not the underlying mechanical problem of the clogged tube. 4. Repositioning may help, but clearing the obstruction is the direct solution. Clinique RN test day tip. The principle for a clogged tube is always to assess the patency and try to clear it, aspirate, flush, before any other complex intervention. Question 15. TPN/PICC complication. A client with a peripherally inserted central catheter, PCC, receiving total parenteral nutrition, TPN, suddenly develops a rapid onset of shortness of breath, a cough, and sharp chest pain. The nurse suspects an air embolism. The nurse's first action is to 1. Administer 100% oxygen via a non-rebreather mask. 2. Place the client immediately in the left lateral Trendelenburg position. 3. Clamp the PICC line immediately. 4. Notify the healthcare provider of the critical change. The correct answer is 3. Clamp the PICC line immediately. Rationale. The symptoms, SOB, chest pain, indicate a severe air embolism, where air has entered the venous circulation, likely through the open or damaged PICC line. The immediate priority is to stop the source of the air entry by clamping the PICC line. Incorrect options. 2. Placing the client in the left lateral Trendelenburg position is the intervention done after clamping the line. This position helps trap the air bubble in the apex of the right ventricle, away from the pulmonary artery. 1 and 4. Oxygen and provider notification are critical secondary actions. Stop the source first. Clinique RN test day tip. For a suspected air embolism, remember the sequence. Clamp the catheter to position the client, left lateral Trendelenburg, to oxygen, then finally notify the provider. Question 16. Hyperglycemic crisis fluid. The nurse is preparing initial IV fluids for a client admitted with a blood glucose of 950 milligrams per deciliter and severe dehydration due to hyperosmolar hyperglycemic state, HHS. The nurse anticipates an order for 1. 0.9% sodium chloride in S. 2. 0.45% sodium chloride, half in S. 3. 5% dextrose in water, D5W. 4. 3% hypertonic saline. The correct answer is 2. 0.45% sodium chloride, half in S. Rationale. The client has severe cellular dehydration due to osmotic diuresis and is hypernatremic. The goal is to correct the dehydration slowly. The initial fluid of choice is a hypotonic solution, like 0.45% in S, to shift fluid back into the cells, rehydrating them slowly and safely. Incorrect option, 1 in S, is isotonic and may not effectively shift fluid into the severely dehydrated cells. 3 dextrose solutions are contraindicated initially, as they would worsen the hyperglycemia. 4 hypertonic saline is contraindicated as it would pull even more fluid out of the cells, worsening cellular dehydration and increasing the risk of central pontine myelinolysis, brain injury. Clinique RN test day tip. The primary problem in HHS is extreme dehydration. Start treatment with a hypotonic solution, half in S, to rehydrate the cells gently. Question 17. DKA treatment evaluation. A client is receiving treatment for diabetic ketoacidosis, DKA. The nurse knows that the treatment is effective when the client's ABG results show a decrease in 1. Partial pressure of oxygen. 2. Partial pressure of carbon dioxide. 3. HCO3 bicarbonate. 4. Anion gap. The correct answer is 4. Anion gap. Rationale. DKA is characterized by metabolic acidosis caused by the presence of unmeasured keto acids. The goal of treatment, insulin, fluids, is to stop ketogenesis. The best indicator of successful DKA treatment and resolution of the acidosis is the closure, decrease, of the anion gap, which is high in DKA. Incorrect options. 1 and 2. Partial pressure of oxygen and partial pressure of carbon dioxide are respiratory components. 3 HCO3 bicarbonate will be low in DKA. It will increase as the condition resolves, so a decrease would indicate worsening acidosis. Clinique RN test day tip. DKA is a metabolic problem. The marker for a metabolic acidosis, like DKA, is the anion gap. You want the gap to close, decrease. Question 18. Barium swallow priority. A client is scheduled for a barium swallow study. Which instruction is the most important for the nurse to provide before the procedure? 1. Instruct the client to remain NPO for 8 hours prior to the exam. 2. Explain that the client will receive an IV contrast dye during the exam. 3. Instruct the client to stop all oral medications 24 hours prior to the exam. 4. Advise the client that they may feel a strong urge to urinate during the exam. correct answer is 1. Instruct the client to remain NPO for 8 hours prior to the exam. Rationale. A barium swallow is a radiological exam of the upper GI tract. The client must be NPO for 6 to 8 hours prior to the exam to ensure the upper GI tract is empty. Failure to do so risks aspiration during the exam and compromises the clarity of the results. Incorrect options. 2. A barium swallow uses an oral contrast, barium, not an IV contrast dye. 3 and 4. These are not standard requirements or sensations for a barium swallow. Clinique RN Test Day Tip. All procedures involving visualization of the GI tract require the client to be NPO to ensure an empty tract and prevent aspiration. Question 19. TPN line management. A client's TPN is infusing via a dedicated central line. The central line alarm sounds, indicating a blockage. The nurse attempts to flush the line without success. The nurse's next best action is to 1. Forcefully push the syringe plunger to clear the blockage. 2. Attempt to flush the line with a sodium bicarbonate solution. 3. Apply heat to the site and notify the provider of the issue. 4. Clamp the line and attempt to draw blood back from the catheter. The correct answer is 3. Apply heat to the site and notify the provider of the issue. Rationale. The line may be blocked by a fibrin sheath or a lipid clot from the TPN. The safest action is to apply heat, a warm pack, to the site to promote dilation and potentially loosen the clot, then notify the provider to obtain an order for a thrombolytic agent, example, alteplase, to instill in the line. Incorrect options. 1. Forceful flushing is strictly contraindicated, as it can dislodge a thrombus/embolus into the circulation, potentially causing a stroke or PE. 2. Bicarbonate is not the typical solution for a central line clot. 4. Attempting to draw back blood is the initial assessment step, but the next action is treatment and notification. Clinique RN Test Day Tip. The cardinal rule for central lines. Never force a flush. A blocked line is a safety issue. Always notify the provider for a thrombolytic order. Question 20. Colostomy priority. The nurse is providing immediate post-operative care for a client who underwent a new colostomy placement. The nurse should be most concerned about an assessment finding of 1. Stoma is moist, pink, and slightly swollen. 2. Client reports mild tenderness at the stoma site. 3. Stoma is pale, dusky, and slightly cyanotic. 4. Small amount of serosanguinous fluid oozing from the stoma. The correct answer is 3. Stoma is pale, dusky, and slightly cyanotic. Rationale. A pale, dusky, or cyanotic, blue, stoma indicates poor circulation and tissue ischemia/necrosis. This is an immediate surgical emergency requiring urgent notification of the surgeon to prevent further tissue death. Incorrect options. 1. A moist, pink, and slightly swollen stoma is a normal and expected finding immediately after surgery. 2. Mild tenderness is expected post-operatively. For a small amount of serosanguinous, pink, or watery, drainage is expected. Clinique RN Test Day Tip. For stoma assessment, remember the color code. Pink/red to good blood flow. Pale blue-black then bad blood flow. Ischemia/necrosis. Question 21. Fluid shift post-hemodialysis. A client who received 3 liters of fluid removal during hemodialysis is now confused, dizzy, and complaining of a severe headache. The nurse should suspect 1. Disequilibrium syndrome. 2. Air embolism. 3. Hypokalemia. 4. Arteriovenous, AV, fistula rupture. The correct answer is 1. Disequilibrium syndrome. Rationale. Dialysis disequilibrium syndrome, DDS, is a neurological complication caused by the rapid removal of solutes, urea, from the blood but slower removal from the brain cells. This creates a temporary osmotic gradient, causing fluid to shift into the brain cells, cerebral edema. Symptoms include headache, nausea, confusion, and restlessness. Incorrect options. 2. An air embolism is caused by air entering the line, not fluid shifts, and presents with chest pain and dyspnea. 3. Hypokalemia is a risk, but the neurological symptoms of headache and confusion point specifically to DDS. 4. Fistula rupture would present with sudden bleeding and hypotension. Clinique RN test day tip. Post-dialysis neurological symptoms, headache, confusion, dizziness, should make you immediately suspect disequilibrium syndrome. Question 22. Hypoglycemia versus hyperglycemia confusion. A client with diabetes who received insulin 30 minutes ago is now tachycardic and diaphoretic. The nurse should first administer 1. A prescribed dose of NPH insulin. 2. 50% dextrose for push. 3. A rapid-acting oral carbohydrate, e.g., 4 ounces juice. 4. Glucagon 1 mg IM. The correct answer is 3. A rapid-acting oral carbohydrate, example, 4 ounces juice. Rationale. The symptoms, tachycardia, diaphoresis, are classic signs of hypoglycemia, low blood sugar, which is likely occurring because the insulin is starting to take effect. Since the client is likely conscious, no mention of unresponsiveness, and can swallow, the least invasive, safest, and fastest intervention is to administer a rapid-acting oral carbohydrate. Incorrect options 2 and 4. D50W and glucagon are reserved for clients who are unconscious or seizing and cannot safely take oral food. 1. Administering more insulin would worsen the hypoglycemia. Clinique RN test day tip. Always follow the rule of 15. Give 15 g of rapid-acting carb, wait 15 minutes, recheck blood sugar. Only resort to IM or IV if the client is unconscious or unable to swallow. Question 23. Post-bronchoscopy priority. A client returns from a bronchoscopy. Which assessment finding is the nurse's highest priority? 1. Client reports mild soreness in the throat. 2. Client is coughing up small amounts of sputum. 3. Client is drinking water and juice without difficulty. 4. Gag reflex is present. The correct answer is 4. Gag reflex is present. Rationale. The throat is anesthetized during a bronchoscopy. The highest priority is to ensure the gag reflex has returned before the client is allowed to have anything by mouth. The presence of a gag reflex confirms the airway is protected and the risk of aspiration is minimized. Incorrect options 1 and 2. Mild soreness and small amounts of sputum are expected post-procedure. 3. Allowing the client to drink before confirming a gag reflex is highly unsafe and can lead to aspiration. Clinique RN test day tip. For any procedure that involves the upper airway, bronchoscopy, EGD, anesthesia, the highest priority is to confirm the return of the gag reflex before allowing oral intake. Question 24. Infection control priority. A client is admitted with profuse diarrhea suspected to be due to Clostridioides difficile, C. diff. Which action is the highest priority upon room assignment? 1. Ensure the client is placed in a private room. 2. Place hand sanitizer outside the client's room. 3. Ensure the client is wearing a surgical mask. 4. Notify the dietary department to send disposable trays. The correct answer is 1. Ensure the client is placed in a private room. Rationale. C. Difficile requires contact precautions. The single most important action for contact precautions is isolation. Therefore, ensuring the client is in a private room is the first step in confining the pathogen. Incorrect options. 2. Alcohol-based hand sanitizer is ineffective against C. diff spores. Soap and water washing are required. Placing sanitizer outside the room is an incorrect intervention for C. diff. 3. A mask is only required for droplet or airborne precautions. 4. Disposable trays are not required for contact precautions. Clinique RN test day tip. For C. diff, contact precautions private room is the key. Remember, wash hands with soap and water, don't use alcohol gel. Question 25. Post-spinal anesthesia side effect. A client who received spinal anesthesia for surgery is 4 hours postoperative. The nurse notes the client has a full bladder and reports difficulty voiding. The nurse should anticipate which immediate order? 1. Administer a dose of naloxone. 2. Administer a prescribed oral analgesic. 3. Perform a straight, intermittent catheterization. 4. Increase the IV fluid rate to encourage voiding. The correct answer is 3. Perform a straight, intermittent catheterization. Rationale: spinal anesthesia often causes temporary bladder atony and urinary retention. The client has a full bladder and inability to void, which can lead to severe pain and potential damage to the bladder wall. The immediate intervention is to empty the bladder via straight catheterization. Incorrect options. 1. Naloxone is for opioid overdose, not urinary retention. 2. Analgesics will only mask the pain from the overdistended bladder. 4. Increasing IV fluids would worsen the bladder distension. Clinique RN test day tip: post-op urinary issues, inability to void after 6 to 8 hours, are very common. The priority is to empty the bladder, catheterize, to prevent long-term damage. Question 26. Thyroid storm assessment. A client with Graves' disease, hyperthyroidism, is admitted to the ICU with a suspected thyroid storm. Which assessment finding is the most critical? 1. Persistent tachycardia above 140 beats per minute. 2. Temperature of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. 3. Complaint of severe anxiety and restlessness. 4. Weight loss of 5 pounds over 2 weeks. The correct answer is 1. Persistent tachycardia above 140 beats per minute. Rationale: thyroid storm is a hypermetabolic crisis. The most critical, life-threatening symptom is the cardiac effect. Severe, persistent tachycardia, greater than or equal to 140 beats per minute, is the highest priority as it can quickly lead to atrial fibrillation, heart failure, and cardiovascular collapse. Incorrect options. 2. The temperature elevation is usually much higher, often greater than or equal to 105 degrees Fahrenheit or 40.5 degrees Celsius. 100.8 degrees Fahrenheit is only a low-grade fever. 3. Anxiety and restlessness are expected, but are not as acutely dangerous as cardiac instability. 4. Weight loss is a chronic symptom of hyperthyroidism, not an acute crisis finding. Clinique RN test day tip: when a question presents an endocrine crisis, thyroid storm, or pheochromocytoma, always prioritize the cardiac symptoms, tachycardia, palpitations, BP changes, as they are the most acutely fatal. Question 27. PEDS dehydration assessment. A nurse is assessing a 9-month-old infant with severe gastroenteritis. Which finding is the most reliable indicator of severe dehydration? 1. Increased heart rate, 150 beats per minute. 2. Sunken fontanelle. 3. Lethargy and poor skin turgor. 4. Capillary refill time greater than 3 seconds. The correct answer is 4. Capillary refill time greater than 3 seconds. Rationale: in pediatric clients, delayed capillary refill time, CRT greater than or equal to 3 seconds, is the most reliable, objective measure of poor peripheral perfusion and circulatory compromise due to severe dehydration/shock. Incorrect options. 1. Tachycardia is an early and nonspecific sign of dehydration. 2. Sunken fontanelles are common in dehydration, but are a subjective assessment. 3. Lethargy and poor skin turgor are also reliable, but are secondary to the objective and quantifiable measure of CRT as an indicator of circulatory shock. Clinique RN test day tip: for pediatric dehydration, the order of reliability is CRT, best objective measure of perfusion, to LOC/turgor, good subjective measures, to heart rate, least specific. Question 28. Therapeutic communication in borderline personality. A client with borderline personality disorder, BPD, tells the nurse, "You are the only person here who truly cares about me. The other nurses are lazy and rude." The nurse's best response is to: 1. Agree with the client's assessment of the other nurse's performance. 2. Tell the client that all staff members are professional and caring. 3. Discuss the client's feelings about the other staff members in a group meeting. 4. Acknowledge the positive feedback and reinforce the consistency of the treatment plan. The correct answer is 4. Acknowledge the positive feedback and reinforce the consistency of the treatment plan. Rationale. The client is using splitting, a defense mechanism where people are seen as either all good or all bad. The therapeutic response is to not participate in the splitting. The nurse should briefly acknowledge the positive feedback and immediately refocus by reinforcing the consistency and shared goals of the entire treatment team. Incorrect options 1 and 2. These options either participate in the splitting or argue with the client, which is ineffective. 3. Discussing staff in a group meeting is unprofessional and inappropriate. Clinique RN Test Day Tip. When a client is splitting, your goal is consistency and unity. Never agree with the negative comments or accept extreme praise. Question 29. Myocardial infarction priority. A client is admitted with an acute myocardial infarction, MI. The nurse's priority action is to prepare to administer which medication? 1. Atenolol, a beta blocker. 2. Lidocaine, an antiarrhythmic. 3. Morphine sulfate, an opioid. 4. Nitroglycerin, a vasodilator. The correct answer is 4. Nitroglycerin, a vasodilator. Rationale. The immediate goal in an acute MI is to relieve pain and improve oxygen supply to the heart muscle, myocardium. Nitroglycerin is the priority because it is a fast-acting vasodilator that reduces preload and dilates coronary arteries, which decreases the workload on the heart and improves blood flow to the ischemic area. Incorrect options. 1. Beta blockers are used, but often after NTG and other initial treatments. 2. Lidocaine is an antiarrhythmic and is not the first-line treatment for an acute MI itself. 3. Morphine is used for pain relief and vasodilation, but is secondary to NTG in the initial protocol, which aims to improve coronary perfusion first. Clinique RN Test Day Tip. The MONA protocol is the standard. The priority drug for improving coronary blood flow and relieving cardiac pain is nitroglycerin. Question 30. Fluid management in DIC. A client in septic shock with disseminated intravascular coagulation, DIC, is hemorrhaging. The provider orders the rapid infusion of 0.9% NS. The nurse should recognize that this intervention primarily addresses which aspect of the client's condition? 1. Correction of the underlying clotting factor deficiency. 2. Maintenance of tissue perfusion and blood pressure. 3. Reversal of the widespread vasodilation caused by sepsis. 4. Replacement of lost hemoglobin and red blood cells. The correct answer is 2. Maintenance of tissue perfusion and blood pressure. Rationale. The immediate threat from hemorrhage and septic shock is the loss of effective circulating volume, leading to hypotension and poor tissue perfusion. The rapid infusion of NS is a volume expander that is administered to restore intravascular volume and maintain adequate blood pressure and perfusion to vital organs. Incorrect options. 1. Clotting factor deficiency is corrected with FFP, fresh frozen plasma, not NS. 3. Vasodilation is corrected with vasopressors, like norepinephrine, not fluids alone. 4. Lost RBCs are replaced with PRBCs, packed red blood cells, not NS. Clinique RN Test Day Tip. Fluids, saline, correct volume. Blood, PRBCs, corrects the O2 carrying capacity. FFP corrects clotting factors. In shock or bleeding, restoring volume, perfusion, is the immediate priority. You made it to the end, but did you survive? Click the link at the top corner to take our free daily Nclex test, your next shot at redemption. And before you go, like, comment, and subscribe. The next test might be even tougher.